Well, I was amazed. A friend of mine came here, and they diagnosed a stroke. I was just amazed they could diagnose a stroke.
That's a good one, because a lot of times when a patient comes in with stroke type symptoms, there's visual stuff that they're describing, and it doesn't always look bad. You can look inside an eye. The eye can look healthy, but they're just describing maybe a part of their visual field that just doesn't seem quite right. Or, they look off to the left and you could sneak up on them. Like, how can you, that wasn't like that a week ago. And there's different testing that we can do. Sometimes it's just the exam and we dilate and look at the nerve. But a lot of times stroke stuff is interesting, because if it's behind the optic nerve in the visual pathway, the eye could still look healthy. So there's different testing, visual field testing, and we can map it out. Stroke damage has a specific pattern to it. Glaucoma damage has a particular pattern to it. And you can find these things and then get them out to their primary doctor or cardiologist or whoever they need to go see to get taken care of. The other thing is some people can literally actually have a stroke in the eye, and where the actual vessel in the eye locks up. So again, they're coming in with a visual symptom. It can range anywhere from blurred to distorted to significant change versus the other eye, or versus what they remember being normal. And you look inside and you can actually see the blocked vessel in the eye. You can't look at vessels anywhere else in the body. The eye you can. You dilate the pupil and you look in there, and there's the vessels looking right back at you. You can actually see the blockage. You can see where the blood's leaking. And again, it's traumatic for the patient. They've got obviously significant symptoms. And again, you get them out to the proper referral source. In our office, we're very fortunate. We've got our own retina people that come in and handle these kind of things every day. So it seems it's probably pretty routine to the retina doctor himself. Not routine to the patient that's just in your chair going, I was fine yesterday, and I'm not fine today. What's changed? And those people are easy to help. I like those people. Then you get some that decide, it's been like this for a month or two. Okay, we were on my schedule in the ER. What made it so important today? I mean, I'm glad you're here, but how long? And they don't even know how long it's been like that. Harder to help that person. So if you've got symptoms, visual changes like that, and they don't all have to be as dramatic as I'm being, but that's just me, you get in here. What's the worst thing that happens? You have an eye exam, you complain about the dilation, you wear the funny sunglasses home, and we tell you you're fine. But if there's something going on, let us find it and get you the proper care.